Assalamualaikum. Today we are going to see the instruments of septoplasty. This is the video destined for medical students who are going to appear in their exam, where one of these instruments will be present in their TOEIC examination. Here we have these set of instruments. These are called Killian's nasal speculum. They are available in multiple sizes, from smaller to medium size to large size as well, depending upon the size of the nasal cavity, length of the nasal cavity. This is a self-retaining instrument. This is Killian nasal speculum. This is how we hold this instrument. We insert into the nasal cavity, and this gets open, and we can visualize from before backwards. This is Killian's nasal speculum. You can see. Okay. This one is the self-retaining Killian. We can insert it, and we can adjust the screw on the size of this Killian, and this will remain in place. We may leave it as such. Both of our hands will be free once we insert and we use this screw. This is again Killian's nasal speculum. We will unscrew it, it will be closed. Next, this is a scalpel or blade handle. This is used for making an incision at the distal end of the septum, where we need to incise the flap, and then we give an incision and elevate the flap. This is a very important instrument. You can see both ends are to be used. This is called Freer's double-ended periosteum or perichondrial elevated. You can see Freer's double-ended perichondrial or periosteal elevated. As the name indicates, this instrument is used to elevate the periosteum or perichondrium of the septum, because we need to expose the septal cartilage. So this instrument is Freer's double-ended periosteal or perichondrial elevator. It is used to elevate the perichondrium from the septal cartilage, so as to expose the septal framework. Once we expose the septal framework, then we give a small incision in the septal cartilage, and we have to remove a thin strip along the floor of nose. We may need to use this instrument to cut the cartilage. This is also used to cut the turbinate. Actually, this is called turbinectomy scissors. You can see it has got a typical beak shape. This is called turbinectomy scissors. It may be used to cut the turbinate, and sometimes we also use it to cut some piece of septal cartilage along the floor of the nose. Once we remove the septal cartilage, then most often we have to face the bony septal spur. These two instruments are used in conjunction. This is called gouge, this is hammer. So this gouge and hammer, they are used to remove the bony septal hump from the floor of the septum, floor of the nasal cavity, and bony hump is removed with the help of this hammer and gouge. You can see the curve in the center, hammer and gouge. I can magnify for you as well. Okay, we have a piece of cartilage which needs to be removed, or we have a bony spur which is now broken down and we need to remove it. This is called Tilly's Henkel forceps. You can see the typical shape of this instrument from this joint to this tip. Only the terminal part of the instrument opens, so this instrument is used when we need to enter into a narrow cavity, especially in maxillary sinus, etc. But it has got a delicate grip. Please remember, the grip is delicate, but the entrance is in a narrow cavity. Only the terminal part opens, and you can also see the joint. This is Tilly's Henkel, H-A-N-K-L-E, Tilly's Henkel forceps. Now, sometimes, rather many a time, we need to remove part of spur which is now broken down already. We need to use this instrument. This is called Lux forceps. You can see the shape. Screw joint over here, and the entire instrument opens. This is called Lux forceps. This instrument needs a wider space to enter. This is available in many sizes actually. I can show you other sizes as well. But the grip of this Lux forceps is far better than the Tilly Henkel forceps which we saw earlier. Here we have another Lux forceps for you. You can see the margins of the Lux forceps and screw joint, large forceps which has a good grip, powerful grip, but it needs a larger space. Lux forceps. When we are done with our septum, we have removed some part of septum, or we have performed our septoplasty, then we need to pack the nasal cavity. Before packing, we need to stitch. These two forceps are used for suturing. While suturing the septum, this is plain forceps. This plain forceps is used to handle the cartilage, because the tooth forceps may damage the cartilage itself. We need to close the flap, and we'll hold the flap with this, and then we'll suture the flap. This is tooth forceps. You can see the tooth at the distal end, very sharp, fine tooth. So tooth forceps is used when we need to hold firmly. For example, we have placed the splint in the nasal cavity, we need to stitch those splints, then we'll hold the splints in this tooth forceps, and the cartilage alone will be held in with the plain forceps. And once we are done with this job of septoplasty, then we need to pack, and this is a very important instrument used in almost every ENT surgery. This is called Tilly's dressing forceps. Please see the shape of this instrument, Tilly's dressing forceps. It has got a typical hockey-like curve because we want to avoid our hands coming into our way while packing the nasal cavity or external canal, so our hands do not come into our VM, and we can easily pack the nasal cavity under VM. This is again Tilly's dressing forceps. Here we have two another instruments. This is a suction tip. It is available in multiple sizes, 4, 6, 8, 10, 12, multiple numbers. This is used for suction of secretions and blood within the nasal cavity while performing any nasal surgery. This is Yanker's suction tube, Yanker's suction tip, also called pharyngeal sucker. This sucker is used in almost all the surgeries, not only in ENT but in abdominal surgeries and all other surgeries. This is used when there is gross hemorrhage or secretions or excessive suctioning from the throat. Yanker's suction tip. Suction tip. Now lastly we'll revise once. Killian's nasal speculum. This is our needle holder which is used to hold the needle. This is towel clamp, hammer and gouge, turbinectomy scissors, Lux forceps, Tilly Henkel forceps, tooth forceps, plain forceps, Tilly dressing forceps, and this is the last one, Freer's double-ended periosteum or perichondral elevator.